skin smoothing and tightening procedures at Renew Metaspa, concentrating on the face and neck. So the whole reason we see fine lines, wrinkles, and sagging skin is due to loss of collagen and elastin in the skin. And this happens as we age, of course, and for a number of other reasons. There are certain environmental factors which cause what's called oxidative stress on the skin. These are things like having a diet high in sugar, lacking antioxidants in the skin, perhaps, not eating enough fruits and vegetables. Certainly excessive sun exposure is a stress on the skin, as well as smoking, chronic stress in general, and then the effects of pollution. So these oxidative stresses not only damage the collagen and elastin, but also damage our fibroblasts, which are those cells in our skin that make the collagen and elastin. So this results in, over time, fewer fibroblasts, which means less new collagen is produced. So really starting in our early 20s is when we start to lose collagen, and then by the age of 40, we're probably losing about 1% of collagen per year, and that process accelerates as we get older. Now, I get this question all the time, what about collagen supplements? Should I take collagen supplements? There are some studies that suggest that collagen supplementation, collagen peptides, may slow the signs of aging, perhaps primarily by helping to keep the skin hydrated, and that will help reduce the appearance of wrinkles as well. Now, there are many different types of sources of collagen supplements. I happen to prefer this one, this Nordic Naturals Marine Source Collagen, which also has some vitamin C in it. It dissolves very easily in water. It's not gritty. It has a very faint strawberry taste. I think it's pretty palatable, easy to take, and not super expensive. And studies have shown that you can safely take 2.5 up to 15 grams of collagen peptides per day. So your choice. I will say that I certainly have never seen a collagen supplement have a visible dramatic impact, on wrinkles, over a period of time. I don't have any clients who've told me that they've taken collagen and it solved their problem. So I think of this more as a protective role, as an enhancement, but not really as a wrinkle treatment per se. So quote unquote Botox, certainly very popular for wrinkle improvement. However, we are somewhat limited in terms of the areas we can use Botox to improve wrinkles, and there's also a limit to what the Botox can do. The tox simply works by relaxing the muscles that will make the wrinkles deeper in areas, certain areas where we have a lot of facial expression. Botox certainly doesn't fill a wrinkle, and there are many areas where clients have wrinkles they want to address, but we can't do that with a tox because we don't want to relax the muscles in that area. So as you probably already know from previous videos, there are 5 different brands currently on the market of tox, and it's certainly something we consider in the face and even sometimes the neck for wrinkle improvement, but we often have to go beyond tox effect to get the kind of smoothing that our clients are looking for. Dermal fillers, certainly, yes, something we use to attack some fine lines and wrinkles. They can help smooth some of them. They can't always get you to exactly the appearance that you want in a given region. Most of the dermal fillers that are used for fine lines and wrinkles are made of what we call hyaluronic acid, which is a naturally occurring substance in the body. Of course, their hyaluronic acid is, engineered to be longer lasting and to blend in very naturally looking with your skin, especially the brand that we carry, which is the RHA. And this RHA Redensity is especially good for etched lines on the face. So that may be an option that we present to you depending on where the wrinkles are located and how many of them there are. Dermal fillers do not tighten skin. Okay, they don't, we can achieve some lifting in certain areas with dermal fillers, particularly in the cheek region, sometimes along the jawline. But again, we often hit a wall with these. We don't want to overplump areas of the face, so that we often have to get to other mechanisms to restore lost collagen. But dermal filler is certainly something to consider for some instant gratification in some of your deeper wrinkles. So restoring collagen and elastin, what are the methods? I kind of broke them down into categories here. So we have on the left a category that I refer to as microinjury using laser. So this is most commonly something like laser skin resurfacing, such as with our SmartSkin CO2 laser. We have another laser called LaserMD, MD, which is a little bit lighter level exfoliation, a lot less downtime than SmartSkin. We have some laser facials, which I discussed in another video, like our clear and smooth and our bright and smooth laser facials. Those are also lighter level collagen stimulating lasers. So if you want to learn more about laser induced collagen stimulation, I would refer you primarily to our video Laser Facials at Renew Metaspa, and you can see what that's all about. So we may often go that route if we have someone who is looking to stimulate collagen and also has excess redness they want to address, or also has a lot of sun damage pigment that they want to address, because the laser can often simultaneously stimulate collagen and address those other concerns. In the middle column here, we have microinjury other, and that means we're using other energy sources to create that microinjury to stimulate the cells in the skin to restore that lost collagen and elastin. Very, very commonly, that heat is created through radiofrequency energy. So we have several radiofrequency microneedling devices, one being Lutronic Genius, one being AGNES RF, and one being Profound RF. They have some overlap. We'll be going into that, but they all use the same mechanism, which is needling with heat delivered at the tips of the needles for double action in collagen and elastin stimulation. Going down from there, we then have Ultherapy, which rather than using radiofrequency, uses microfocused ultrasound, but the end result is the same. We are creating heat in the skin layers in order to stimulate collagen and elastin. And finally, medical microneedling, either with or without what's called platelet-rich plasma, another way to create injury to stimulate collagen. And on the right, other forms of stimulation. We have, again, platelet-rich plasma, which is your own growth factors in platelets, which we take from a blood sample. We also have something called PDO smoothing threads, which I'll show you, that slip into the skin and dissolve, but while they're there, will stimulate collagen to form. And coming in 2023, we also are bringing in a device called TriWave, which is LED and near infrared energy, which will stimulate collagen. We're very excited about that. And finally, of course, medical grade skincare, those products that we do sell here that you can take home and use on a daily basis to support the procedures that you're having done and to extend your results. So laser facials, again, I'll just refer you. I won't go through this table, but this is in the laser facial video where it shows you, based on your concerns on the left, you can see our most popular laser treatments at the top, and going across, you can see which ones address which concerns. And then at the bottom, I mentioned the downtime expected from these procedures and even a ballpark of the cost. So if you use a table like this and you sort of start prioritizing, what your concerns might be, you can better see, I think, when it comes to laser facials, what you might ask questions about or in which direction you might want to turn. So let's start with one of the oldest procedures around, which is medical microneedling. Now, medical microneedling uses an automated pen, which has sterile single-use tips, so a different tip for each client for each treatment. That's very important for safety. It's a series of sessions for sure, generally 4 or more weeks apart. So this is a way to mechanically stimulate the body to make collagen, but not using anything generating heat. Now, it's safe for all skin types. We use just topical numbing for this, so there doesn't need to be any injections. And there's really minimal downtime. I mean, most people will have a little redness, a little flakiness for a few days. We use the skin pen device, which was the first FDA-cleared microneedling device, also made in the USA, which we like. You can see that there are very nice results, and it's safer and more effective than dermal rollers. When you combine microneedling with PRP, you're getting 2 mechanisms of collagen stimulation. You're getting the collagen stimulation of the needling itself, and then the collagen stimulation and collagen production support of growth factors, which are contained in your platelets, which we can get from a sample of your blood drawn the same day of the procedure. So you can see here in this video, there's the PRP in the syringe, and the microneedling device is being used in various areas of the face. The patient is perfectly comfortable. It's very uncommon to have a reaction after this other than the redness and the slight dryness and flakiness. We do recommend that you use good grade skincare after these procedures. Now moving on to microneedling with heat. The Lutronic Genius is one of the devices, as I mentioned, that we use for this. Again, you're getting combination therapy here of microneedling plus heat stimulation. So dual stimulation, double the collagen. This is generally at Renew performed by an RN or nurse practitioner. And again, minimal downtime pretty much similar downtime to microneedling, regular microneedling, but just maybe extended another day or so because of the heat component, maybe a little more puffiness, again, because of the heat component. And in 2023, we brought in also smaller treatment heads for this, so we can now work in small areas, such as around the eyes and these delicate areas, and also we can do localized treatments around the mouth if desired. And here we can see a video of the Lutronic Genius being performed. So you can see here it's a stamping mechanism. It is automated. The tips are sterile, of course, single-use tips. Any area on the face can be treated. We do full face. As I said, we do regional now, just around the eyes, just around the mouth. And you can see here the demo method of action where the needles go in and the heat is only delivered at the tips of the needles, which spares the surface layer from the heat, which is important in terms of downtime. Once that heat and microneedling stimulation is there, the body's repair mechanisms go into effect and you get new collagen and elastin. We also have some topical products that we can place onto the skin during the procedure, and we can also combine it with what's called Localized MD, which is a laser overlay treatment. When we combine the Lutronic Genius with the Localized MD, that at Renew is called total skin because it's treating all 3 skin layers. And as you see, the heat creates these microchannels, and that's the heat of the Localized MD as well. And then we're able also to use some topical products immediately after these channels are created to deliver extra nutrients to the skin, things for lightening, things for brightening, antioxidants, other collagen support topicals. So if you do opt for the ampule add-on, that will be placed on the skin. As you can see, right after the microchannels are created, and that leads to much better penetration of the topical.
Is that okay?
Yeah.
How was that?
Very good.
Very good?
Yeah,
okay.
didn't feel a thing.
Okay. That's perfect.
Mm-hmm.
So far, so good?
Yeah, very
Awesome.
good.
Are you feeling anything other than pressure?
I am not.
Another microneedling with RF heat device, which I mentioned, was AGNES. Now you can see here on the right, the tip for AGNES is much smaller than the Lutronic Genius tip. So that gives us some very unique capabilities with the AGNES because we can really customize small area treatment, especially around the eyes. We can treat fat pads there, which I'll show you. So while there's overlap, there are some things that AGNES can do uniquely, and that's why we brought it in. Here you see with AGNES an example of treating the, here you see with AGNES an example of treating the eye region, especially that under eye region, very often an area of concern for our clients, the tear trough area. We can get skin smoothing and skin tightening with the AGNES RF treatments. This is performed either by RN, nurse practitioner, or MD. Primarily, again, because of the size, that delicate size of the handpiece of the needling, we're sticking mostly to face areas and the upper portion of the neck with AGNES. We're not doing larger body areas. The AGNES will produce more downtime than the Lutronic Genius, so sometimes that will make the decision for someone between one or the other. It does require, in most instances, injection of lidocaine into the area for numbing rather than just topical numbing. And unique to the AGNES is fat cell reduction or fat cell destruction. So we're often using that if someone has a protruding eye fat pad underneath. And also we're able to shrink fat in the jowl region and also under the chin. So we can attack that with AGNES, but not with Lutronic Genius. So that is a differentiating factor. Here's an example of AGNES treatment zones. This is about as extensive as we get. I'm treating around the mouth, plus the jawline, and plus that upper neck region. But you can see a very nice result even from a single session of treatment with AGNES. Here you see the AGNES being used in that submental region. So a double chin is certainly a frequent concern that we're presented with. And even when people lose weight, it's very difficult to lose weight from this zone. So the specialized needle of the AGNES allows us to get in there and attack that. And yet we then switch the needle and you see we can treat the skin here right under the brow, causing that to both smooth and tighten. We can also treat fine lines above the brow and on the forehead. with AGNES as well, and we can do brow lifting. So right there, you see the needle going in to the forehead region. Now, the client is not feeling the heat or sharp pain. Everything's been lidocaine numbed by injection prior to performing this procedure. Radiofrequency procedures cannot be performed on someone who has a pacemaker or an implanted defibrillator, electronic device like that, because of the grounding pad that we need to use. But otherwise, most people are a candidate for radiofrequency microneedling. Here are some examples. Again, AGNES periorbital, single session. There's some improvement in skin tightness as well as skin smoothness. I think that's pretty evident from the image. Here's another one showing improved skin thickness and smoothness. In this under eye region, you can see that despite the same lighting, the skin looks lighter, brighter. You don't see the veins as easily because the skin has thickened some. And the dots just indicate what the treatment area was in these photos. Here's an example of some brow lifting achieved with AGNES. And to see that, you have to look at how much lid is showing between, let's say, the lash line and the brow. And then you can appreciate that there is some lifting going on there. Moving on to actually the first RF microneedling device we had and still have is Profound RF. Now, Profound RF we tend to use for more advanced loose skin conditions, especially along the jawline. We are not able to lift brows with the Profound RF. If you take a look in the picture there, you can see that the handpiece is much larger. It's meant to be used in larger zones, so we're not able to work around the mouth with it. We're not able to work around the eye, and it's cumbersome up here on the forehead because the needles will tend to go too deeply up there. So we are able, though, because of the size of the handpiece, to use this on the body. So I'll show you that. Here's an example of combination therapy where we use Profound RF for smoothing and tightening, combined with an injectable collagen stimulator called Sculptra for volume restoration. And that was 2 sessions of Sculptra for this lovely client. And you can see she got a very nice smoothing and lifting and volumizing result from that combination therapy. Very frequently, we will use Profound on the backs of the thighs and or the upper buttock zone if we're looking for more smoothing and tightening there. We have also used it on the abdomen to improve skin tone and texture in that region. And on the neck, you can see in this video, that's what someone looks like right after the treatment. You can see redness, a little bruising, but again, a very nice result on that neck and lower face region. Ultherapy, as I mentioned earlier, uses micro-focused ultrasound. It is a treatment that we can use on the face, the neck, the chest, and also elsewhere on the body. Again, this delivers heat using micro-focused ultrasound. There is no injection numbing used generally with Ultherapy, and topical numbing in the most cases doesn't help much. We primarily use Pronox during Ultherapy treatments for pain control. Essentially, if the Ultherapy has no downtime, which makes it quite popular, Ultherapy is most often something that someone will do every 3 to 4 years. It is able to stimulate collagen at a deeper level. There also is an Ultherapy transducer or treatment head, which is more surface smoothing, and several that are more about the deeper tightening. So if you have further questions about Ultherapy, we're certainly happy to answer those. As you can see here on the left, this is our nurse Victor performing Ultherapy. Several different treatment depths. As outlined there, you can see that they're delivering heat at different levels in order to achieve the desired result. Here's an example of a smoothing treatment with Ultherapy at 3 months, single session. We can perform brow lifting with Ultherapy. It does require more than 1 session, but you can see this result even with 1 session is noticeable. And jawline improvement with Ultherapy as well. What Ultherapy cannot do in the face and the jowl or that submental region is destroy fat cells to any significant extent. So we can't use it for that. We would need to go with AGNES, or even Profound RF has a tip that we can reduce fat cell number in the under chin area, though we don't use it on the jowl. So all these different variations, you can start to see where there's overlap, but there are unique niches for certain of these devices where we say this one is preferred for that, or this one does not have that versatility. So that's going to help us, basically get you the results you want by considering what your various goals are and then matching it to the best device to achieve those goals. Smoothing PDO threads are fun to use. This is a popular procedure in particular for smaller areas. I do fairly frequently use it in the angry 11 glabellar lines, as you can see in these images. Smoothing threads can be used on the neck, they can be used around the mouth, pretty much anywhere you want to mesh these threads, within reason, you're going to get collagen stimulation. In the cartoon there, you can see that the thread is on a needle introducer. So the needle gets the thread into and under the skin, and then the needle is withdrawn and the thread remains behind. They dissolve over the course of 3 months, but for the whole time that they're there, they will stimulate collagen in the area. I've used them on forehead lines. On the image on the left, you can see that we've drawn out lots of different areas where we might create a mesh of these threads to stimulate collagen. It's nice to combine this also with platelet-rich plasma to get that double mechanism, that double whammy collagen stimulation. So we'll often do that on many areas of the face and also on the neck. New for 2023 will be TriWave MD. Now, TriWave MD is stimulating collagen. It is completely non-invasive. The sessions are quick, just 20 minutes. There is zero downtime. There's no special prep or numbing. You just need to not have makeup on the skin that's going to be treated. We will be able to treat face or body. It is for collagen stimulation, so for skin rejuvenation. Also great for anti-acne. We can do faces, chests, backs. As you can see, this device is going to be super versatile. It's also very beneficial for eczema and psoriasis. So the TriWave MD is the world's most powerful LED system for this type of treatment. It is the only device that can deliver these 3 clinically proven wavelengths. We will be doing a whole separate video about that, showing you how it works and who it can benefit. So stay tuned for more on TriWave MD. These are the 3 wavelengths. The blue 415 destroys acne-causing bacteria and also reduces mild to moderate inflammation. The red 633 nanometer is great for cell renewal, boosting collagen, targeting those visible signs of aging, and also reducing some pigmented lesion appearance. And the near infrared is for healing and also reduction of inflammation. So that's going to be a super addition to our treatment armamentarium, and we look forward to offering this treatment in June of 2023. So as a summary, again, I like to put these tables together because it can, I feel like it can sort of lay it out and you can start to put it all together, hopefully. You can see across the top of this table, I put downtime, and that's because I find that's one of the most important factors when someone is choosing a procedure is what is their tolerance for downtime. So we go from no downtime on the left to minimal in the middle and to moderate to even higher on the right. And on the left side in blue, you can see some of the most common concerns, let's say for the face and neck. And so you can see, for example, if I want to just treat around my eyes, what are my options? Well, Ultherapy, Lutronic Genius, PDO threads, AGNES, and SmartSkin CO2 are all options. All right. They're going to vary according to downtime. They're going to vary according to cost, right? And according to other, other things they can treat. So for example, if you're treating around your eyes, but one of your issues around your eyes is a bulging fat pocket, right? Ultherapy can't help the fat pocket. It can help smoothing and tightening, but it can't help the fat pocket. So if that's a secondary goal or a secondary issue, we would take that off the table for you. And as I mentioned, Lutronic Genius also cannot treat an under eye fat pocket. So that drops off. PDO threads can help a little bit with an under eye fat pocket over time with multiple procedures. So that may still be an option. AGNES is definitely an option. So you see, by having 2 concerns, under eye smoothing and tightening plus under eye fat pad, it suddenly narrowed our choices down, to really just a couple when we started with more than that. So I hope that makes sense. Same thing with something like reducing jowl size. All right, if you want to reduce the jowl size, you can see that takes us immediately over to AGNES or possibly another procedure, which is a little more involved in terms of jawline contouring, but Precision TX is another procedure I do for fat pads because it enables me to do some liposuction. So I hope this is helpful to you. SmartSkin CO2 laser is a very advanced laser procedure that is laser skin resurfacing. That is very often a procedure we're using if we want full face smoothing, full face collagen stimulation. We can get right up to the eyelid with it, so we can treat all areas right up to the lip line. But significant downtime. You really want to have 7 to 10 days of not that you have to hide from the public that whole time, but 7 to 10 days. You're going to be for sure noticeably red. So sometimes that drops that off the table or makes it something that someone wants to do at a particular time of year or when they have some vacation time. So let's look at some examples. Here's an image of a woman, and we often get women who come in with these concerns. They're just starting to see fine lines and wrinkles, especially around the mouth, a very dynamic area, and they want to know what to do about that. So, I'll call these early fine lines. This woman might be in her early 40s, for example. That would be a common age to have this concern. So as you can see, the concern is on the milder end, so that opens treatment options up to lots, right? We can do microneedling either with or without PRP. You can do microneedling with radiofrequency heat. Total skin would be a great one for this. Ultherapy smoothing treatments are an option. PDO smoothing threads, definitely an option. A limited dermal filler, and I say limited because we don't want to overplump, right? So I could certainly take a syringe, for example, of RHA Redensity and work someone's vertical lip lines or work an etched line in the nasolabial fold region. That's easy to do. Other light-based treatment options also are certainly to be considered here. I started to mention the TriWave. That's going to be a great, no fuss, no downtime collagen boosting treatment. That's an option for skin condition. Now go to the other end of the spectrum. Okay, very advanced, likely not just age, but also sun exposure related changes. Now, changes this significant are going to cause us to recommend treatments that have more downtime, that are more involved, that are stronger because the condition we're treating is more advanced. Okay, so someone with this degree of wrinkling is not likely to see enough change with something like Ultherapy smoothing or PDO smoothing threads or even or the TriWave MD, that sort of thing. We have to bring out the big guns for the big gun conditions. So that's going to be the SmartSkin CO2 for sure. We certainly want to consider restoring lost volume. You can see how flat the cheeks are here. We need to give this skin something to drape over. So volume restoration will be important. Talks between her brows would really help to reduce the depth of the lines there. And skincare is still going to be an important part of her treatment regimen. Sometimes we get clients who come in and although they have some changes in a variety of different areas, they want to focus on a specific area. And they'll say something like, I know I got this, I got that, but this is what bothers me just right here. All right, so if you want to treat just a localized area rather than full face, we have treatment options that we're going to recommend that can just be used locally. So volume restoration in this case with some dermal filler could certainly be helpful. We could do PRP, we could do some of those PDO smoothing threads. As I mentioned, the Lutronic Genius is one of the devices that we will just work in a region, just periorally, small area. So in summary, collagen stimulating procedures, certainly are many and varied at Renew. Your key considerations in terms of figuring out which to do or in which order or in which combination, right, are number one, are we treating full face or localized? Number two, what's your tolerance for downtime? Do you need minimal, none, okay, lots of downtime? What's it going to be? Because that's going to certainly impact what we recommend to you. What is, as I mentioned, the severity of the collagen loss and the volume loss that you're starting with? What are your overall treatment goals? What are the other things that need to be improved simultaneously, like brown spots or excess redness? What are your time constraints? How quickly do you need to see a change? And we will tell you number of sessions anticipated, which will vary. Stronger treatments, you'll get more collagen per treatment, but with more downtime. The lighter treatments, you'll get less collagen, but with minimal or no downtime. So that may impact your decision. The goals of our consultation are very simply to get some intake information, like your medical history, your prescription meds, your allergies. We help you prioritize your concerns. You can see my consultants work with a form like this on the left, where they're listing your concerns, and then they're listing what they recommend based on their experience of working with me for a very long time in most instances. And then they also give you comments about downtime and cost and number of procedures. Understanding your options for addressing concerns is the most important goal of a consultation. So they'll help you plan out course of treatment based on several factors that I've mentioned in this video. What's your budget? And what's, as I mentioned, your timeline. So all of that, we help you sort through all of that and come up with, some top recommendations. And then what happens is I, as the physician, get this paperwork, get a copy of it, and I look at all of that. I look at the paperwork that you fill out in terms of the medical history, and I look at the photographic images that have been taken. In most cases, I sign off and say, yep, I agree with everything that's been recommended. In some instances, I'll have something to add or something to tweak, or I will have an opinion about this is going to be better than that, etc. So I may make some further suggestions, and the consultant then takes those suggestions and communicates them back to you by phone and or email to make sure that you have all of the information you need to decide when and if you're going to proceed. These are no pressure consultations, no high pressure sales. This is all about education. So we do encourage you to take advantage of that. You can do either a head to toe consultation where you're talking about lots of different concerns, face, neck, and or body, or sexual wellness. That can be thrown in there too. Or you can ask for a limited consultation if you really want to just focus on, let's say, one or two concerns, or, I just want to talk about my eyes, or I just want to talk about sexual wellness, or I just want to talk about, abdominal contouring procedures, that sort of thing. So either generalized head to toe, if you will, or localized consultations, more limited consultations are available. So I hope this information has been helpful. We welcome you to ask more questions. You can always contact us by starting a chat on our website or by emailing us at info@renewmedspa.com or calling us at 603-931-4345. Thank you so much for your attention.